This is the FM Gold channel of All India Radio. In the program Spotlight, we now bring you a discussion on preparation of the government against coronavirus. The participants are Dr. Ashutosh Biswas from All India Institute of Medical Sciences and Ridhima Kaul, journalist.
Coronavirus, in fact novel coronavirus, it is being talked about world over. There has been an outbreak that started in China and it has spread to almost 25 countries now. Everybody is talking about it. What is the disease? What are the impacts? And what is our government doing to ensure that the disease doesn't spread across India? We have taken a lot of measures. There is airport screening of patients, or rather passengers, that has taken place. There are seaports where passengers are being screened, international seaports, borders touching those countries from where cases have been detected, like Nepal. We are screening passengers, people coming from there. Thermal screening is the mainstay because fever is one of the key symptoms that patients get if you are infected with coronavirus. At least 21 airports, people are being screened, thermal scanners. Then community surveillance, another important aspect. We have around 5,000 people who are being monitored as we speak. Could be more. The numbers are growing every hour. These are people who have traveled or have come into contact with people who have a travel history. Overall, government is prepared to deal with any emergency. Our Apex lab, the ICMR NIV lab, which is in Pune, which is constantly testing samples. We have evacuated more than 647 passengers, students, Indians from Wuhan who are under quarantine right now. They are being observed for any symptoms that they might develop because they have come from a country where the disease is at its peak. So we'll speak with Dr. Ashutosh Biswas on the disease and how serious is the situation.
At this moment, we are really passing a very serious time here because this coronavirus, as you said, this spreading from the epicenter, Wuhan, the central city of the China, from where it is spreading across the globe. And it's very last 2 to 3 weeks within that, about 30 countries are affected with this. So India is also at this moment, we are having 3 confirmed cases. But I am confident that the government front administrative level that we have taken measures to cut down the transmission. At this moment, we are sure that these 3 cases are from Wuhan and confirmed that, and there is no indigenous transmission. There is no detection of human-to-human transmission occurring in our country. So that is safe. So we are very much sure that all the cases are imported from China. These are all, and the persons, all the visitors, students, there we have kept under quarantine in 2 places that we know, the 2 phases that all the students, about 600 more people are quarantined. So waiting for the development of the symptoms. See, as soon as we are testing them and we are trying to control and diagnosing so that we are taking very hard steps against this. And another, the 3 cases which are detected in Kerala. Health surveillance system is very strong and we know these are all 3 cases are coming from China. And immediately these are all contact tracing is also going on because this contact tracing is to get the secondary and tertiary contact, primary, another person likely to transmit. So we are having the contact tracing to understand and to know the person is developing symptoms or not. Should not be any window to transmit these all viruses in the community.
What is the incubation period?
It's usually 14 days, but yes, 28 days up to, at this moment is at home, up to 28 days we're keeping under surveillance that if anybody is in contact with confirmed cases or coming from China, they're home quarantine. So we are usually advising them they should not go out to mix the crowd, the market or other outside home. So till 24 days after that, anybody is safe almost. But at the same time, as we are putting some surveillance system, screening system at the different entry route level at the airport and the route of the water and the land also. All the port are really under scanner. Sometimes there is also possibility that those who are not having symptoms likely to have infection and then may come in and may transmit. But those cases we are tracing, those are coming from China especially, are quarantined. So that way we are really very hard steps also to cut down all ways, all routes to import the diseases if at all the people are coming. Because this disease cannot fly. Although it is thought to be that transmitted by the cats, camel and bats, those animal transmission may be but very minimal because already it has spill over to the human So now there is a chance of transmission from human to human. In India yet, there is no human to human transmission. All we get the cases coming from China. Also, we are, each and every states are taking very seriously about the all travel persons, any contact anywhere through the China or other way. So they're trying to isolate them. And isolation is one at the hospital, quarantine at home also, and also different places that already identified, those who are directly brought by the air route quarantine. So we're waiting. We are sure that probably we would be able to control. We will not have the situation like China that really they are facing. So we are very much strict. I hope there is nothing to be panic about this.
Is it also the state of Kerala, which has already seen Nipah, which was a big infection that we feared might become even bigger, but they managed to contain it? Like in this case, so they had a public health emergency system already in place, which they activated almost immediately once the first case got reported. So do you think it helps when you have a system in place?
Definitely, yes. Last 2 times that Kerala has been affected with the Nipah. So the system is already in place that, but the mode of transmission is almost the viral. It is also through droplet and also direct contact. So this is what the same way that virus also transmitted the droplet or the airborne. They have the very strong surveillance system, Kerala. So probably these cases are detected in Kerala. So they have immediately declared the state calamities and immediately they are trying whatever the best way, pushing their whole strength to cut down this transmission as soon as possible.
Do you think we will be able to contain this disease because of all the surveillance measures that we are taking? At the airport, that is the first entry point. We have created dedicated gates and the transfer of patients is happening or passengers is happening through aero bridges. So they have done that special system in place. So this will help?
The people, those who are coming from China, these diseases are already suspected among those. So we are very serious about that. Those who are coming, then we are placing them under quarantine or at home or maybe at hospital. Indigenous cases in Thailand that there is no travel history and among them also those people it is detected, but not in India. So I think at this moment nothing to worry about. If you are sure about all the people coming from China and testing them and putting them under quarantine, there is nothing to be panic about this disease at this moment. If you look at the China and the spreading across, it is the human being they have transmitted. But those people who are the citizen of different countries have gone from China to their own land, they are under screening, quarantine, and they are trying to control it.
Important thing, Dr. Biswas, is sample testing. We have National Institute of Virology in Pune that is quite capable of handling samples in large numbers. But we have at the same time added more labs. There are 11 labs in all which are prepared, geared up. AIIMS New Delhi has started doing testing of samples. Do you think we have enough system to test samples?
At this moment, I think we should not go for increasing this lab because the cases are minimum and just 3 cases and we know these are all coming from the China. So there is nothing indigenous transmission or any disease really has taken bad shape for transmission. So at this moment, I think whatever the testing facilities there is capable of. But if it is required in emergency, sometimes it's a lot of testing. So probably government is going to gear up this testing facilities across the country. Every state can do that.
It's interesting to say a lot of ministries are involved. It's a collaboration of sorts. Aviation Ministry is involved, Ministry of External Affairs is involved, Ministry of course Health and Family Welfare is there. So all the ministries have come into action and come together to actually put in place a system where they can ensure that the virus doesn't come into the country. That was the first priority. Now that we already have 3 cases, now our top priority is to ensure that we don't spread the disease. Disease is contained up to just a minimum number of people. Do you think this kind of initiative, this kind of coming forth of different organizations or different departments of government, that helps?
Definitely it is a joint venture. Only the Ministry of Health, because it is not at all a health issue at this moment. But the people are coming, traveling. Through the travel, the disease is transmitting very fast. So travel advisories is very important as Government of India has taken initiative to cancel all the flights directly coming from the China or going to China. So that's a very important steps right in the beginning we have taken. So aviation department is very important. Also other routes through the Navy, the land also, those are connected. So these are all, and also internally there are administrative people that really it is for the prevention. It is very important that media people, that we are creating awareness among the people that how you should protect yourself, or how the prevention is very important. That if somebody is affected, like one should not go to the crowd. In the crowded places, we don't know, maintain 1 meter at least distance, and handshaking is not advised because this is a direct contact. So it's better to practice our Indian system, namaste, and no hugging. When we probably sneezing and common cold, use
Cough etiquette.
cough etiquettes, that using a cloth or handkerchief. And also when you are symptomatic, you should not go around to transmit, use the mask. That is one. So these are the very important advisories that people are becoming aware and taking seriously about. Everybody's role is not a government, it's individual roles. Public health important role they're playing to curtain also this.
So prevention, you spelled out a lot of steps that one can do. But at home quarantine also we need to keep in mind certain measures. It's not just staying at home, but at home also you are supposed to behave in a certain way to ensure that at least your family members who are around you, they don't catch the infection. So what are those steps if you?
I'm thinking that I am not symptomatic. Suppose I traveled to the other states. Now I'm not having symptoms, so I am asked to be at home. So how I'm going to behave? So at least 14 to 28 days I should be away from my family members. If at all, at least maintain a gap of 1 meter distance, even at home. Because sometimes we are not symptomatic, but maybe symptomatic cases are also seen that.
So it's better to stay in one room.
Yeah, one room. So isolation in one room and not much of physical contact with anybody, so that we know that the physical contact is also transmitting the disease. And when any time develop symptom, immediately should be reported to the hospital, to the doctors to get the treatment.
And Dr. Biswas, it is called novel coronavirus, which means it's new. So what are the complications when we are dealing with something new that hasn't been seen before?
The coronavirus family, like the SARS and MERS also, these are all under the same family members. So it's a new kind of viruses similar to that in the same family. It has not been reported from the human being. It already is reported from the animal. Spilling over from animal to first time into human society. And now this is rapidly spreading. So we don't know at this moment exactly how this virus is going to behave. Initially, we are not sure what would be the clinical signs, symptoms, presentation. So over these few weeks, we came to know this virus is behaving like this. And also it is a learning curve for the scientists also, and everybody is similar to the other viruses. But if you go for the SARS last in 2002 and 3, the mortality was very high. So it is compared to the SARS, this virus, coronavirus, is less fatal than the SARS. It is almost 2% the mortality, and it was in the SARS is around 9%. So around 800 people died this last time. So it's not really the very fatal like others. So at this moment it is less fatal than other coronavirus. And this is usually transmitted. What happens is going to the respiratory tract, and the mucous membrane of the respiratory tract, that is most important, vulnerable, risk exposed, and then going into the blood and then subsequently causing pneumonia and other organ involvement. This is how severity increases. So if we, in the initial stage, we can really go for a symptomatic treatment. At this moment, we don't have any approved drugs for the treating to kill this virus. Now, this is an RNA virus, and then we have no drugs against this. Although there are some clinical trial, in China they are using other drugs, but not yet been fully proved that it is really acting against this. So symptomatic treatment is the mainstay for managing these cases.
Before we get the vaccine, which will eventually be the preventive measure, right?
Yes.
Thank you so much.
You were listening to a discussion on preparation of the government against coronavirus. The participants were Dr. Ashutosh Biswas from All India Institute of Medical Sciences and Ridhima Kaul, journalist. This program was produced and presented by the News Services Division of All India Radio. This program is also available on our website, newsonair.com. You can also follow us on the News on AIR app for updates. You may email your opinion about this program at airnsdtalks@gmail.com. Please stand by for our next program, Countrywide, in a short while from now.